Okay, so here we are with the halter. So I think I was talking about his OA. Yes, that's you. How handsome you are. Um, because he has PPID, we know that there's hormonal things going on. So the most important thing for me to work on, really, depending on if I'm working on the PPID or a neurologic condition or his teeth, um, his OA is extremely important because that's where the brainstem is. And when I started working on him, I started remembering things that I didn't remember before. Like right before, probably about a year before he was diagnosed neurologic. And I don't usually talk when I'm doing treatment, so that's a little confusing to him too. He doesn't know that he's on camera. Um, we were riding in the arena and we were actually cantering up to the gate, and he somersaulted with me, literally somersaulted with me. Um, and then laid in like a dog position so that I could get off. And I got off, and he just laid there for a while. And about 6 months after that was when I was riding him, and it felt like, it felt like his right leg came out of a socket. I was trotting, and all of a sudden it just went. And I got off, and I walked him, and I looked at him, and he looked fine, so I got back on. And as soon as I got back on, it returned, and I didn't even remember those things like until I decided to work on him. Can you come here with me? Can you come here with me, handsome guy? So I'm doing a lateral decompression right now, trying to spread the atlas so that the brainstem can release and his dural tube or dura tube can flow better with his cerebral spinal fluid, which is exactly what he needs. Um, there's many other spots in his body that I need to work on, but I believe this is the most important because I believe it's definitely an OA injury where he went back and um, probably injured his pole and his brainstem. And after that, everything kind of, it's tough. Everything kind of got worse after that, and everything affects everything, I guess is what I'm trying to say. One little thing that you don't think about when it happens, really. I thought he was fine. There you go, buddy. There you go. Yeah. You don't think about it when it happens because, I mean, I looked at him and I was like, oh, he's fine. He just tripped. I didn't think much of it. Love him so much. But now when I'm starting to document these things and think about them, I look back at that, and all those things. Okay, so you injure your neck and it pinches your brainstem and the cerebral spinal fluid stops flowing and then it gets stagnated and then it starts affecting your right hind leg and it starts affecting your back and it starts affecting the way you chew because your TMJ joint is now jammed and your mandible is attached to and it's just, downhill from there. So I have to work very slowly, yeah, and very consistently. And I'm just going to freak out my vet when this horse is healed. That's what I'm going to do. I'm just going to freak him out. So I'm going to work on his TMJ again now because that seems to be a huge problem for him. The first video I did where he was yawning and releasing his jaw and stretching his head and all that, and he did that for about 10 minutes. That was all TMJ. Well, it wasn't all TMJ, but it was a lot TMJ. So I just do a little bit every day, and as soon as I can figure out this video thing, I have a GoPro, but that doesn't really seem to work because sometimes I like to be in the video, and the GoPro just kind of shows what I'm doing. All of these things that he's doing, like that, show a change. He's not shaking off flies, guys. He's readjusting to the way his bones just changed and his joints just changed. Now would be the time for you to look in the camera, Mr. MC. Could you do that? Yeah, could you? He wants to go for a walk. That's what halter means. So yeah. So I also need to work on I need to work on everything. His temporal bones here. He's super reactive up here, which he never was in his whole life with me. Never had a problem with his ears. Now he thinks there's something, I don't really know. But he'll relax in a minute. And like if I breathe with him and really set my intention to what I'm doing, I'm actually just inviting the temporalis and the temporal bones to release. I'm not pulling. He's pulling a little bit. I like it when he does that actually because that says to me that something is happening. Those little sutures in those cranial bones move in little tiny increments. Very important tiny little increments, as you will see, because you're going to see this horse change. And we're going to see his PPID and neurologic problem go away when I get through every single little part of his body. So anyway, I'm not pulling. My hands are here just inviting the tissue and the bones to release. And I need to set my intention a little better probably because I'm talking too much. So I'm just going to breathe with him for a minute. I hope y'all don't mind. You can feel, hi, you can feel the tissue release. That's what happens. Yes, yes, Mac. So he's shaking his head a little. He's like, what the heck just happened to me? That's what all that is about. Hi. Hi. I love you. I love you. So anyway, that's what that all is about. But like I said, I don't usually talk when I'm treating. So I guess I need to practice that, practice talking and setting my intention. And it's easier for me to do that with horses that I don't know. There you go. This is also another reason I hate having halters on because he can't really release his jaw as much as I would like. See how that halter is right down on his mandible? So anyway, that's another thing to consider. I can put a neck rope on him. Maybe I'll do that next time because that's a pretty good idea. There we go. See that? I mean, that's huge, guys. He wasn't doing that before. So you know something is happening. And it is. Like I said, you'll watch his pictures. Please continue to watch my videos if you find them interesting or helpful or whatever. I think I'm going to put them on my YouTube. My YouTube is Tracy's Rescue. Whoa, see, that's a huge one. Huge one. I need to do like a lot of work up here in this cranium. I cannot stress that enough. That's where everything comes from. He can't get healthy spinal fluid back to the rest of his body without this being open. So craniosacral is my #1 priority for him right now. Like I said, I have a lot more work to do, and that's just an example, and I'll do a little bit of everything every day. See if I can't get my GoPro to work. I have a hard time figuring out technology. And I'll do the diaphragmatic releases with the GoPro because that way you can see his body, and the diaphragmatic releases will go all the way back. So now he is acting like he wants to roll, which is interesting because this is not a normal place for him to roll. This is his shelter and where he eats. He usually rolls down there. So I'm actually going to let him go and just see what he does. And I'll just switch that camera around for a minute And we'll follow Mac. Let me see if I can figure out how to switch it. Hi. This is Tracy that doesn't know how to work technology. Yeah, that little thingy doesn't come on. Okay, I'm just going to stop it.